Hello, can you hear me? Hello, I'm Professor Dr. Dustin Dumbélle. Thanks so much for having me here. I'm delighted to be amongst you all, striving academics of the future, just like I was once in the past. No longer I have tenure now, so I've moved on myself. I'm actually Professor Dr. Dustin Dumbélle, PhD, PhD, PhD. I have 3 PhDs. But I don't always emphasize that. It's fine for people to just say 1 PhD on the end, but I should mention that it is actually 3. My first PhD was on, it was a study of the intertextual lexicon of Mexican sexual methexis. Then I moved on to my next PhD, which was actually a self-reflexive autoethnography of my first PhD. And then my third PhD, which I conducted simultaneously to my second PhD and a postdoc at the same time, was actually a self-help book for other people writing PhDs, because I realized that not everyone is as productive as me. So the book that came from my third PhD was How to Write a Cheaper PhD. And then I actually wrote a follow-up book to the first book, which was The Skinny Professor, Saving Cash While Shedding Pounds, which was a way of writing a cheaper PhD while also doing enough exercise to lose weight at the same time, hitting several goals all at once. And it's that kind of well-motivated, aspirational attitude which I think will get through us through this crisis, because after all, crisis is opportunity in Japanese, I believe. So now, I have to say, as the assistant, not as, assistant, that was the abbreviation, the assistant vice provost for deconstructing graduate welfare, that's my Derridean turn, if you will. As in that position, I am here to listen to and deconstruct your questions in the best and most welfare-oriented possible way. So I'm listening. I know at the moment I'm talking and you're all muted, but in general and in a more abstract sense, I am listening. I believe Shan, is it Shan, that you had some questions there from different concerned students in this situation?
Yes, Professor Doctor. I would like to ask a question. It's a testimony from one of our graduate students. The students ask you, she has lost her jobs, not one job, but multiple jobs. And she had to move house during the COVID-19 crisis. And this has triggered her ongoing chronic health condition and heightened her anxiety. She has not been able to do her thesis. Why can't she get universal extension from the Melbourne University?
Very interesting. Thank you, Shan, for that question. Well, you see, the university as a whole, I know that your group is demanding universal extension, 6 months, everyone gets paid, and so on. Well, I would just remind you that you are one group of stakeholders in this situation. There are other stakeholders, and we have to consider all the stakeholders, government, staff, students in this situation, and everyone plays a part. Everyone cooks a steak, whether it's rare or medium rare. But the main thing to consider here is that anxiety in this kind of situation can be a state of mind, which is why a person in this kind of situation should consider my book, Dustin Dumbélle's 10-Step Guide to Success. And in that book, I actually have various weight loss and exercise techniques. She mentioned a chronic health condition. Again, chronic can become achronic when doing exercise. So if I've got a nice Merlot here. I have a little anecdote here. I acknowledge your campaign. I think that's wonderful that you're showing that initiative, although you could be a bit more active, but I understand you are all in your houses as well. And I actually, during my student days, I considered myself a Chardonnay socialist. Since then, I've moved on to be perhaps a Merlot moderate or a Shiraz centrist even, which is why I do love a drop every so often. So if your friend who's suffering these anxiety conditions, if I just suggest that she just takes a little sip of wine to take the edge off, and then she could use a household implement, such as a wine bottle. I've got a lovely Pinot Grigio here, and she could just do some exercises, lifting that back and forth in this way, just gently, and that will offer some wonderful abdomen strengthening, as well as bicep, and if the tricep, if she goes up and down like that.
Thank you, Professor Doctor, but I don't think that's very helpful. I've got another question from an international student. The international student said that she is on exchange at Melbourne University,
right,
and she'll soon to be left with no financial support when her exchange ends, and she will be stranded in Australia. Her visa will expire, yet she cannot apply for any one of the government's COVID-19 support packages. What can University of Melbourne offer her?
Well, we offer her our good wishes. And I think perhaps she should take our good wishes with a little bit more good grace. And if that's not working, perhaps in her house she would have a Ming vase. And she can do a very delicate weight lifting technique with the Ming vase in one hand. And that could work quite well to help with some of those stresses. Once again, exercise is the panacea. And if she could do this, I've seen some mentions in the comments about mindfulness, just some breathing at the same time. Just breathe in and out, lift the vase. Again, bring the wine back in the other hand, lift the wine and the vase at the same time. Or if she's looking for some oral stimulation, that's oral, the ear, she could get some records, some vinyls. I have here Offenbach. I put this on my Dumbélle playlist, and she could lift the record at the same time. Or perhaps if she's not into Offenbach, which I know everyone's not, I also have Dvorak. She could lift the Dvorak up and down, again with the wine in the other hand. Any more questions?
Professor Doctor, I'm pretty sure that's very racist in terms of the Ming vase. Racist. Racism.
I bought it during a trip to China. I paid full price.
Oh, well, thank you, but not. I want to open the floor to the audience to invite any postgraduate student here if you have a quick question for Professor Dr. Dustin Dumbélle. So if you do, please put your hand up. Okay, we have one. We have Rosie here. Rosie, you're unmuted.
Hi, so you've spoken a bit about student welfare. I was just wondering, what your thoughts are on how we can improve our well-being when we're destitute and, dealing with existential dread and not getting any help from the university.
Well, I found reading Nietzsche helped me with my existential dread during my undergrad. I made several advances there. So you really just have to push through and come out the other side. For instance, if you have, like me, a signed portrait of Nelson Mandela during a trip to South Africa, which you might have conducted in the past on important academic business, you just get that and you lift it up and down during your exercises. And it also helps wonderfully with exercise. Again, when you talk about destitution, dread, wanting a 6-month extension, wanting to be paid, wanting more time, these are all wants, want. And you're demanding wants. When the Dustin Dumbélle mentality is shifting from demanding wants to asking for needs. And so actually when I was in South Africa, I applied my philosophy in that situation to the Roads Must Fall campaign. You can see that in that campaign, roads must fall. Must, that's a want. Fall, that's a want. Must, a demand. So I suggested changing that to roads could listen. Now, unfortunately, I was subsequently informed that Rhodes has been dead for some time. But in general, you can apply that philosophy to any situation. Thank you, Rosie.
All right. I'm pretty sure our time's up. Thank you, Professor Dr. Dustin Dumbélle. It was thoroughly unhelpful. We will continue our fight for universal extensions.
Thank you.
Yes, you can have last word.
Could I just say, as a final piece of advice for your weightlifting, if you have some silver cutlery, perhaps in a box set, you can just lift those and say, if you have a child who is irritating you, I know lots of people at home have children which are irritating. My child, Dixon, is actually learning French. So I've got Dixon's French dictionary here. And if you just lift that in one hand and then the cutlery in the other hand, that's wonderful exercise. Thank you for listening. And I thank myself for listening to you too.